Greetings, esteemed readers and guardians of your personal, long-term physiological integrity. Today, we direct our attention toward a critically important, yet frequently overlooked area of health: the quiet, profound systemic sabotage inflicted upon our finely tuned biochemical landscape by seemingly insignificant, routine daily decisions. We are embarking on an extensive investigation into 12 prevalent, often insidious behaviors that are relentlessly, yet progressively, eroding the functionality of your vital renal system. The kidneys are, without exaggeration, the body's most crucial regulatory organs, the undisputed chemical masters, sophisticated filtration powerhouses, and supreme architects of fluid balance. They bear the sole immense responsibility for maintaining perfect systemic equilibrium. The exquisite, precise balance of circulating body fluids, essential electrolytes, blood pressure, and the efficient removal of metabolic waste products. Yet, the devastation wrought by chronic kidney disease, CKD, is tragically swift and predominantly asymptomatic in its nascent stages, earning it the chilling, clinically accurate moniker, the silent killer. A startling number of us engage in damaging behaviors without fully comprehending the immediate peril, primarily because CKD advances stealthily for years. A staggering 90% of those afflicted do not perceive the subtle, early warning signs until severe, often irreversible, structural and functional damage has firmly taken hold. The profound silver lining to this crisis is that preventing this catastrophic decline is largely within the direct realm of personal control and informed behavioral modification. Optimal, enduring kidney protection is achieved through deliberate, evidence-based, and consistently healthy lifestyle choices. Conversely, maintaining just a few of the detrimental habits outlined below, often adopted purely out of sheer convenience, ingrained habit, or a crippling lack of critical awareness, will cause your vital renal function to decline gradually and permanently. Below are 12 key factors contributing to the progressive, often unseen, deterioration of kidney health. 1. Excessive sodium consumption. The first habit that severely compromises the intricate renal architecture and functional capacity is the persistent, high overconsumption of common table salt, sodium chloride, particularly the astronomical amounts often hidden within commercially processed, packaged, and restaurant foods. While a moderate intake of sodium is biochemically essential for crucial nerve signal transmission and muscle contraction, consuming it in chronic excess places an enormous, unnecessary osmotic and mechanical burden directly upon the renal filtration apparatus. The mechanism of damage, osmotic stress. When the circulatory system is flooded with surplus sodium, the kidneys are compelled to work strenuously overtime in a frantic attempt to rebalance the concentration gradient. This high salt load severely disrupts the vital sodium-potassium regulatory axis, compelling the body to retain massive amounts of water to dilute the sodium concentration in the blood. This resultant mechanism leads directly and immediately to elevated circulatory volume and persistent systemic hypertension, chronically high blood pressure, hypertensive shear stress, and glomerular fibrosis. This resultant, persistent high blood pressure applies extreme, destructive physical shear stress, a mechanical force akin to continuous internal trauma, to the tiny, delicate capillary loops housed within the primary filtering units of the kidneys, known as the glomeruli. This chronic, unrelenting pressure physically damages and scars these filtration units, a pathology termed glomerular sclerosis or fibrosis, drastically accelerating the decline of the kidney's essential blood cleansing process and promoting the catastrophic leakage of vital proteins, proteinuria. The hidden crisis. According to definitive public health bodies like the World Health Organization, WHO, healthy adults should consume less than 2,000 milligrams, 2 grams, of sodium daily. However, modern epidemiological data confirm that the average American exceeds this recommended limit by 50% or more, often reaching 3,400 milligrams or higher, with the vast majority of this silent sodium intake coming not from the salt shaker at home, but from highly processed foods, restaurant meals, and fast food chains, sources where flavor is artificially boosted by massive salt loads. Practical solutions. Commit to a concerted, gradual effort to drastically reduce the salt added to your home cooking. Instead of relying on the shaker, learn to boost flavor using complex natural seasonings, potent fresh herbs, high-quality spices, umami-rich ingredients, like nutritional yeast or fermented sauces, in moderation, or the sharp acidity of citrus and quality vinegars. A crucial biological takeaway: it typically takes only about 6 to 8 weeks for your palate's taste receptors to fully reset, adapt, and begin to find low-sodium food equally satisfying. 2. Over-reliance on painkillers, NSAIDs. The second most common cause of self-inflicted kidney injury is the indiscriminate, often casual and unsupervised use of over-the-counter, OTC pain medications, particularly for minor, chronic aches and pains that could be managed effectively by safer means, such as physical therapy, heat/cold, or lifestyle changes. The clinical syndrome, medically, kidney damage caused by prolonged exposure to these drugs, is definitively known as analgesic nephropathy. This concern primarily affects individuals who rely on pain relievers for extended periods, especially nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, naproxen, and certain high-dose aspirin regimens. Impact on renal blood flow. These medications operate by inhibiting specific enzymes called prostaglandins. Prostaglandins are absolutely crucial. They function as the kidney's vital, protective vasodilators, keeping the blood vessels relaxed and modulating consistent blood flow to the renal tissue, especially when the body is under stress, e.g., dehydration. By restricting this vital blood supply, a process known as renal vasoconstriction, NSAIDs, can cause acute kidney injury, AKI, in the short term, or chronic, cumulative damage over time due to localized tissue starvation, ischemia, ultimately harming the delicate, oxygen-hungry filtering structures known as the nephrons. Safety recommendation: if you suffer from a chronic condition requiring daily or near-daily pain management, it is imperative that you consult a nephrologist or your primary care physician immediately. They can work to determine the absolute lowest effective dose and the safest duration for use, potentially substituting NSAIDs with non-nephrotoxic alternatives. Never assume OTC medications are safe for daily use. Even seemingly harmless dosages accumulate profound, irreversible cellular and microvascular damage over months and years. 3. Ignoring the call to urinate. The third habit that gradually and persistently undermines renal health is habitually postponing urination when your body signals the urgent need for excretion, often rationalized by overly busy professional schedules, long commutes, or inconvenient timing. Stagnation and pressure risks. When you deliberately suppress the urge to void, the urine remains trapped in the bladder for far too long. This extended retention creates a state of pressurized stagnation, which significantly heightens the risk of developing not only bacterial infections but also resulting high-pressure complications that affect the ureters and, critically, the kidneys themselves. Severe mechanical consequences. Hydronephrosis. If this pattern of retention is repeated frequently over time, it can lead to severe mechanical stress known as hydronephrosis. This dangerous condition occurs when one or both kidneys swell because the urine cannot fully drain, potentially leading to a destructive backflow of pressurized fluid. If left untreated, severe hydronephrosis can destroy the nephrons via pressure atrophy. Infection pathway. Furthermore, retaining warm, stagnant urine provides an ideal, highly concentrated incubation environment for pathogenic bacteria to multiply exponentially, dramatically increasing the risk of painful urinary tract infections, UTIs. Should these virulent bacteria migrate up the ureters to the kidney structures, they cause a severe, high-grade kidney infection, pyelonephritis, that can inflict permanent, extensive scarring, renal fibrosis, on the filtering tissue and, in extreme systemic cases, lead to life-threatening urosepsis, a widespread, dangerous blood infection requiring immediate intensive care. 4. Chronic excessive sugar intake. The fourth major contributor to chronic kidney distress is the persistent, high consumption of refined sugars and the ubiquitous excessive simple carbohydrates found throughout the modern, processed, calorie-dense diet. This behavior is the primary driver of type 2 diabetes, which is now the leading cause of renal failure globally. The glomerular overload, hyperfiltration when blood sugar, glucose, levels consistently remain elevated, chronically exceeding approximately 180 milligrams per deciliter. The kidneys must work relentlessly in a pathological process called hyperfiltration to attempt to excrete this surplus sugar via the urine. This constant osmotic overload forces the glomeruli to overwork and engorge, marking the starting point of structural kidney damage, clinically identified as diabetic nephropathy. Vascular injury and leaky filters. High blood sugar causes direct structural damage, specifically thickening and stiffening the delicate basement membrane of the microvasculature within the glomeruli, largely due to the formation of harmful advanced glycation end products. Ages. This damage causes the kidney filters, which should be almost impervious to large molecules, to become structurally leaky, allowing vital, high molecular weight proteins, most notably albumin, to spill into the urine. This condition, known as proteinuria or albuminuria, is the key, early diagnostic hallmark of chronic kidney disease, CKD, and, if unchecked, rapidly progresses toward end-stage renal failure. Interlinked systemic effects. Excessive sugar consumption is also a powerful synergistic driver of chronic systemic inflammation, pervasive insulin resistance, hypertension, and significant visceral weight gain, all of which pile massive additional pressure onto the already stressed renal system, creating a feedback loop of destruction. Protecting your filters. To safeguard your critical filtering units, minimize or eliminate all refined sugar and all forms of sugary beverages, including seemingly healthy fruit juices, which deliver a concentrated sugar load without the benefit of fiber. Prioritize nutrient-dense sources like whole, unprocessed fruits and vegetables, healthy fats, and high-quality lean protein over calorie-dense, chemically processed junk food. 5. Excessive red meat intake. High acid load. The fifth habit involves consuming red meat in quantities that consistently exceed the body's natural digestive and metabolic regulatory capacity, particularly the limited capacity of the renal system to handle acid waste. Digesting large amounts of red meat generates a significant acidic metabolic load known as the potential renal acid load, PRAL, the acid burden and homeostasis. The kidneys are fundamentally responsible for maintaining the body's delicate pH balance through the excretion of excess acid and regeneration of bicarbonate. When you ingest excessive red meat, rich in sulfur-containing amino acids, the body must handle a substantial, unavoidable influx of metabolic acids. The kidneys must then expend tremendous energy and resources in the renal tubules to neutralize and excrete this acid load, causing direct structural stress on the tubulo-interstitial components and accelerating functional decline over decades. This chronic acidosis is a major driver of bone mineral loss and kidney stone formation. To better protein choices, instead of heavily relying on red meat, prioritize alternative proteins that have a significantly lower net acid load, such as fatty fish, eggs, lean poultry, or robust plant-based proteins, like beans, lentils, tofu, and nuts. These alternatives are substantially less taxing on the renal filtration and acid excretion systems. Note for CKD patients, modern nutritional guidelines recommend individuals with CKD restrict daily protein intake to 0.6 to 0.8 grams per kilogram of body weight to minimize the burden of metabolic nitrogenous waste. For those undergoing dialysis, however, the protein requirement is often higher, typically 1.0 to 1.2 grams per kilogram, to offset necessary protein loss during the complex treatment process. 6. Failure to adhere to UTI treatment. Urinary tract infections, UTIs, are common bacterial infections. Doctors typically prescribe a rigorous, full course of targeted antibiotics, usually 5 to 14 days, for effective, complete eradication of the pathogen. The danger of non-adherence, antibiotic resistance, however, many individuals incorrectly cease medication as soon as their initial, uncomfortable symptoms subside, believing the infection is defeated. This premature cessation places immense selective pressure on the surviving, tougher bacteria, allowing the infection to rebound, often resistant to the current drug and significantly stronger, enabling it to travel further up the urinary tract. Severe kidney complication, pyelonephritis. If the virulent bacterial infection is not completely eradicated, it can travel from the bladder up the ureters to the renal pelvis of the kidneys, resulting in a severe, acute infection called pyelonephritis. This high-grade kidney infection causes permanent, extensive scarring, renal fibrosis, potential abscess formation in the renal cortex, and in the most dangerous, systemic cases, can lead to life-threatening urosepsis, a widespread, dangerous blood infection requiring immediate intensive care and often carrying a high mortality risk. Crucial warning: if you experience symptoms such as painful or frequent urination, a feeling of incomplete bladder emptying, or notice unusual odor, color, or visible blood in your urine, seek immediate medical consultation. You must adhere strictly to the full antibiotic course as prescribed, even if you feel completely better halfway through the regimen, to ensure total bacterial clearance and prevent long-term damage and resistance. 7. Ignoring chronic high blood pressure. Failure to actively monitor, manage, and control high blood pressure, hypertension. Defined as a pressure consistently above 130/80 mmHg, is statistically the single leading, non-diabetic cause of kidney damage and subsequent renal failure worldwide, responsible for destroying nephrons in millions of people annually. Direct vascular impact. Arteriolosclerosis. Chronic high blood pressure systematically destroys the major arteries and blood vessels leading into the kidneys, and, crucially, damages the delicate microcapillary filtering blood vessels, glomeruli, inside the organ. This persistent, elevated pressure creates destructive shear stress, reduces essential blood flow, and triggers the thickening and hardening of arterial walls, arteriosclerosis and arteriolar nephrosclerosis, initiating the irreversible process of renal functional decline. Nephron destruction. Hypertension physically destroys the nephrons, the kidney's basic blood filtering units. The persistent high internal pressure starves the nephrons of the vital oxygen and nutrients necessary for their complex filtration work. As millions of nephrons fail, become dysfunctional, and turn fibrotic, the entire blood cleansing process gradually grinds to a halt, dramatically accelerating the path to end-stage renal disease, ESRD. Proactive monitoring and aggressive management of blood pressure to individualized target levels, often below 120/80 mmHg, are absolutely essential. 8. Poorly managed diabetes. For individuals living with diabetes, allowing blood glucose levels to remain chronically elevated severely damages the intricate, delicate network of blood vessels within the nephrons, a process clinically termed microangiopathy. This is not simply a disease of blood sugar. It is fundamentally a disease of chronic, systemic vascular damage. The statistical toll. Statistics are stark. Roughly 1 in 3 adults with diabetes faces significant kidney complications. When the nephrons are subjected to constant, unbearable osmotic stress from chronic hyperglycemia, their ability to effectively clean the blood, regulate fluid balance, and maintain electrolyte levels is permanently impaired. Progression to CKD, without tight glycemic control, HbA1c below 7%. This microvascular damage inevitably progresses from subtle injury to overt chronic kidney disease, CKD, and ultimately end-stage renal disease, ESRD. Those with a long history of diabetes and persistently poor glycemic control are at a dramatically heightened, almost guaranteed risk of requiring dialysis or transplantation. Managing blood sugar is the single most vital factor in protecting the fragile kidneys of diabetic patients. Regular monitoring for albuminuria via the albumin-to-creatinine ratio, ACR, screening is non-negotiable and provides crucial early warning of filter integrity breakdown. 9. Regularly drinking carbonated sodas. Many individuals rely on the daily habit of consuming highly carbonated soft drinks. While the general public acknowledges these are unhealthy, few grasp the catastrophic, dual chemical damage they inflict directly upon the renal system. The double whammy, dual chemical assault. Frequent soda consumption delivers a massive dose of both refined sugar and phosphoric acid, a powerful dual assault that contributes to renal dysfunction and inflammation. Acid and stone risk. High sugar intake leads to weight gain, diabetes, and heart disease. Furthermore, the phosphoric acid commonly used in darker sodas forces the body's intrinsic buffering system to mobilize essential minerals, primarily calcium, from bones to neutralize the systemic acid load. This chronic leaching of calcium creates a physiological state highly prone to the formation of painful kidney stones, which cause physical trauma, obstruction, and injury to delicate renal tissue. Scientific findings. Epidemiological studies indicate that individuals who regularly consume 2 or more sugary or artificially sweetened sodas per day may face up to a 58% higher risk of developing chronic kidney disease compared to those who abstain entirely, illustrating the intensity of the chemical burden. Healthy alternatives. Eliminate sodas completely to protect your kidneys. Substitute them with filtered water, sparkling water with fruit, or unsweetened herbal tea. 10. Sitting for too long, sedentary lifestyle. A sedentary lifestyle, specifically the habit of remaining seated for extended, uninterrupted periods, is an often overlooked and insidious risk factor for deteriorating kidney health, independent of BMI or dietary choices. The physiological link, metabolic dysregulation research clearly demonstrates that individuals with a chronically low level of physical activity have a higher incidence of renal issues. Prolonged inactivity promotes metabolic syndrome, visceral fat accumulation, and chronic systemic inflammation, all of which severely stress the kidney's regulatory functions. Simple action, major benefit. As little as 15 minutes of mild physical activity daily, or even just regular interruptions to sitting, is sufficient to significantly lower this risk profile. Maintaining physical movement improves overall systemic circulation, crucially including critical blood flow to the renal tissue. 11. Chronic insufficient hydration. Failing to consume adequate fluids can critically damage the kidneys by causing chronic dehydration, hypovolemia, especially in warm climates, during periods of intense physical exertion, or following high salt intake. Electrolyte imbalance and stress. When the body is dehydrated, the delicate balance of essential electrolytes like sodium, phosphate, and potassium is violently disrupted. The kidney must urgently release potent antidiuretic hormones, like ADH/vasopressin, to conserve every drop of water, leading to hyperconcentrated, intensely stressful urine that places a massive workload on the renal medulla. Severe dehydration can lead to debilitating issues ranging from acute kidney injury, AKI, where function temporarily shuts down, to severe, life-threatening electrolyte imbalance requiring emergency hospitalization. Crucial nuance for patients. While sufficient hydration is absolutely essential for healthy individuals, patients with existing, advanced kidney disease must be exceptionally cautious. Drinking too much water can also be severely detrimental and dangerous, as their impaired filters cannot excrete the surplus fluid efficiently. Individuals with impaired kidney function must always consult their nephrologist to determine the appropriate fluid restriction to avoid overburdening their filtering capacity. 12. Smoking tobacco. The final and perhaps most destructive habit is smoking tobacco, which harms nearly every organ system in the body, placing a particularly heavy, acute, and chronic strain on the cardiovascular and renal systems that is difficult to reverse. Vascular contraction and damage. Smoking immediately spikes heart rate and blood pressure due to potent catecholamine release, placing immense, acute strain on the renal vasculature. Furthermore, the thousands of toxins and poisonous substances in cigarette smoke cause direct, irreparable damage to the lining of the blood vessels, the endothelium, throughout the body, leading to accelerated atherosclerosis, arterial hardening. Mechanism of hypoxia, oxygen deprivation. The poisonous substances in tobacco smoke damage the tiny blood vessels in the kidneys and drastically reduce blood flow via sustained vasoconstriction, causing chronic oxygen deprivation, hypoxia. Smoking accelerates kidney aging, significantly speeds up the progression of existing kidney disease exponentially, and multiplies all existing risk factors for new renal problems. Studies link smoking directly to increased proteinuria and a dramatically faster decline toward end-stage renal disease, ESRD. For the sake of your overall systemic health, quitting tobacco is a non-negotiable, urgent intervention that must be prioritized immediately. Thank you for dedicating your time to absorbing this in-depth, vital content regarding the master regulatory systems of your body. We sincerely hope this comprehensive knowledge empowers you to make proactive, necessary lifestyle adjustments immediately to protect your valuable and tireless kidneys. If you found this information beneficial, please share it widely to increase awareness among your friends, family, and community regarding this silent killer. We look forward to engaging with you in our next publication.